Subscribe to our YouTube channel. Press the bell icon to get the latest updates.
So the pause not only allows us to take a look at the cases and learn more, but it is also a signal out there to help the physicians.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.
Calling this pause because people say, what does a pause mean? It really allows both the FDA and the CDC to further investigate these cases to try and understand some of the mechanisms of what it is, some more details about the history of the individuals who were involved that might shed some light on looking forward, what will happen and what we will do. That's the first thing. The other thing is to make physicians out there aware of this, and there are some clinical implications of that I believe are important. For example, if someone comes in with this really rather rare syndrome of thrombotic thrombocytopenia, where you get thromboses, and when you have thromboses, the most common way to treat that is with heparin. That would be a mistake in this situation because it could be dangerous and make the situation much worse. So there's a clinically relevant reason why you want to make this known to people. Also, when individuals, particularly younger women, who might come into a physician with a particular thrombotic phenomenon, which is things that happen for other reasons all the time, that we want to alert physicians to take a history of a recent vaccination. That would be important. So the pause not only allows us to take a look at the cases and learn more, but it is also a signal out there to help the physicians. One of the questions that comes up already rather frequently, does this have anything to do with the efficacy of the vaccine? So we know that there have been 6.85 million doses of J&J distributed in the United States thus far. So someone who maybe had it a month or two ago would say, what does this mean for me? It really doesn't mean anything. You're okay, because if you look at the frame, the time frame when this occurs, it's pretty tight, from a few days, 6 to 13 days from the time of the vaccination. The next question is one that we're all obviously aware of. What impact is this going to have about people's attitudes about vaccines in general? So you might know that there have been now 120 million people that have received at least one dose of a vaccine. Most of that, subtract the 6.85 million, is in the messenger RNA from Pfizer and from Moderna. There have been no red flag signals from those. So you're talking about tens and tens and tens of millions of people who've received vaccine with no adverse effect. This is a really rare event. If you look at what we know so far, there have been 6 out of the 6.85 million doses, which is less than 1 in a million.
I want to say that we have plenty of supply. So I mentioned that we, for the last several weeks, have been sending 25 million doses out. And while we're averaging 3 million shots in arms per day, the 25 million supports actually that level and even accelerating. And we just sent out 28 million doses today, or announced 28 million doses will be sent this week to states, tribes, territories, and through our federal channels. So we have plenty of supply to continue our vaccination program and to hit our goals. But over to Dr. Fauci.
Yeah. I believe your question is, did we pull the trigger too soon on this because it was such a rare event? Well, you know, our FDA is internationally known for their capability of making sure that we have the safest products out there. And that's what I meant when I said an abundance of caution. You want to make sure that safety is the important issue here. We are totally aware that this is a very rare event. We want to get this worked out as quickly as we possibly can. And that's why you see the word pause. In other words, you want to hold off for a bit and very well may go back to that, maybe with some conditions or maybe not. But we want to leave that up to the FDA and the CDC to investigate this carefully. So I don't think it was pulling the trigger too quickly. Well, you know, if you look at the history of, take a look at what has gone on with the Moderna and the Pfizer, where you have, you know, literally tens and tens and tens of millions. This watched us carefully. There had been no red flags. When you have a red flag of something that is as serious as thrombotic thrombocytopenia, particularly when you have an individual, one of whom died, you take that seriously. So I don't think that minimal things that very likely have nothing at all to do with the vaccine, that we're going to pull the trigger so quickly as to keep stopping and stopping and stopping. I think this is an unusual occurrence of a serious adverse event that you want to make sure before you go forward, you investigate it thoroughly. And that's exactly what they're doing. They're pausing so that they can look at it more carefully. That's the reason why the CDC and the FDA want to take a look at this and say, are there some categories now where people outside of that categories don't have any of the factors, so it'll be okay to go on? It is entirely conceivable, making no predictions, that there may be some restriction in an age group or not. We don't know that now. That's the reason why they're working very hard to answer the question you're asking.
Blood clots.
Well, I mean, if someone recently, within days, I would tell them to just, first of all, don't get an anxiety reaction, because remember, it's less than 1 in a million. However, having said that, pay attention. Do you have symptoms? Headache? Do you have shortness of breath? Chest discomfort? Do you have anything that resembles a neurological syndrome? And obviously, if you have something as serious as a seizure, I mean, that's pretty clear. But the manifestations of this are that headache is the very common component of it, because the sinus thromboses that they have is the draining of the blood in the brain, and it will cause enough symptomatology to make you notice it. Just tell people to just watch out for not feeling very well. You know, I think it would be premature to comment on that, and that's the reason why the pause was done, so that they could take a good look at it very carefully, look at every different factor. I wouldn't want to speculate as to what would happen. Often, when you see things like this, that you pause and come back. Whether or not that happens now, I can't guarantee it, but I can tell you that's exactly what the CDC and FDA people are going to be deciding on and looking at very carefully.
Hesitancy amongst a group of people is a challenge, and we need to be addressing it, and we are, as I talked about, by going to meet people where they are, to follow all that we've learned about who people trust, their local doctor, their nurse, their faith leader. And I think that, there's tremendous track record, as Dr. Fauci has talked about, with tens of millions of doses of Pfizer and Moderna. The FDA, acting the way they did today, shows that they are indeed the gold standard, and I think that should reassure the American public that they will be very diligent and conservative in how they approach the vaccines.
There have been no serious events to call attention to anything that would relate to a pause. Right.
Why would it be why would the push for one vaccine but not the other two? And how does that speak to the safety of the other two vaccines?
I think, when you examine everything in general, the fact that you have, 120 million doses, individuals have received at least one dose, and as you subtract out of that 121 million, 6.85, you're talking about, 114 or so million individuals have received at least one dose, and no negative red flag signals. That tells you you're dealing with a really safe vaccine. And I think, apropos of several of the questions that people asked about hesitancy, when you want to talk about safety, this is an extraordinary safety record that the others have. And the fact that a pause was done, I think, just as a testimony to how seriously we take safety and why we have an FDA and a CDC that looks at this very carefully and hopefully will resolve it pretty soon, within days to weeks, apropos of your question. So I think it's a very strong argument for safety, actually.
Thank you, Dr. Fauci. Thank you, Jeff.
Thank you.
Really
Thank you,
appreciate
everybody.
taking the time. Thank you.
Thank
Insights from the world's best medical minds. You are watching TheRightDoctors.com.